Hello students and friends. Welcome to Homeopathy Medicines. Today in this Homeopathic Materia Medica lesson, I will discuss about homeopathic medicine Mercurius corrosivus. Before starting this video, please subscribe to this channel for Learn Homeopathy Online free and Homeopathy Materia Medica. We need support from you to make this channel more beautiful and more informative. Now going to discuss about Mercurius corrosivus, its uses and symptoms. This salt leads all other remedies in tenesmus of the rectum, which is incessant, and is not relieved by the stool. The tenesmus often involves the bladder as well. Bright's disease. Gonorrhea, second stage, with continuous tenesmus. Destroys the secreting portions of the kidneys. This process is slow, but sure. Albuminuria in early pregnancy, phosphlator and at full term. Head, delirium, stupor. Frontal pain, congestion of head with burning in cheeks. Drawing pain and periosteum of skull. Eyes, pain behind eyeballs, as if forced out. Flictnuli, deep ulcers on cornea. Excessive photophobia and acrid lacrimation. Iritis, ordinary or syphilitic, given association with atropine locally for prevention of adhesions. Pain severe at night, burning, shooting, tearing. Little tendency to pus formation. Iris muddy in color, thick, and neither contracts nor dilates. Retinitis albuminuric, ophthalmia neonatorum. Lids edematous, red, excoriated. Severe burning. Soreness of the eyes. Nose, excessive coryza. Ozaina, with perforation of septum nasi, kali bitch. Rawness and smarting in nostrils. Postnasal swelling, mucous membrane dry, red, and covered with bloody mucus. Ears, violent pulsations. Fetid pus. Face, swollen. Red, puffy. Lips black, swollen. Sores. Facial neuralgia within the bones. Mouth, teeth loose. Gums purple, swollen, and spongy. Tongue swollen and inflamed. Salivation. Pyorrhea. Ptylism. Taste salty and bitter. Throat, red, swollen, painful, intensely inflamed. Uvula swollen. Swallowing painful. Most pain and postnasal with sharp pains to ears. Burning pain, with great swelling, worse, slight external pressure. All glands about thorax swollen. Stomach, incessant, green, bilious vomiting. Epigastrium very sensitive. Abdomen, bruised sensation, cecal region and transverse colon painful. Bloated, very painful to least touch. Stool, dysentery, tenesmus, not relieved by stool, incessant. Still hot, bloody, slimy, offensive, with cutting pains and shreds of mucous membrane. Respiratory, pain in larynx as cut with knife. Aphonia. Cough, with bloody expectoration. Pulse rapid and intermittent. Stitches through side of chest. Urine, intense burning in urethra. Urine hot, burning, scanty or suppressed, bloody, greenish discharge. Albuminous. Tenesmus of bladder. Stabbing pain extending up urethra into bladder. Perspiration after urinating. Male, penis and testes enormously swollen. Chancres assume phage-denic appearance. Gonorrhea, urethra orifice red, swollen, glands sore and hot. Discharge greenish, thick. Fever, chilly from slightest exposure. Profuse perspiration, surface cold. Modalities, worse, evening, night. Acids, better, while at rest. Merc. Cor. Has more excoriation and burning, more activity and excitement. Merc. Is slower and more sluggish. Merc. Cor. Is violent and active in its movements, it takes hold and runs its course with greater activity. So with a mercury base we have often to prefer this salt. In the eye symptoms there is more excoriation. The pains, burning, smarting, etc., in the eruptions and ulcers are more violent. In Merc. We have slow-spreading ulcers, but in Merc. Cor. There is great eating, it will spread over an area as large as your hand in a night. He has the mercurial odor and sweat, and he is sallow. He needs mercury, but a more active preparation than Viv. Mercor has decided symptoms of its own, but they are limited. You cannot tell the ptylism, or the lardaceous ulcers apart. In sore throat, if it is a Merc case, the ulcers are spreading rapidly and burning and smarting like coals of fire. You would say that Merc is not so intense as this. You need Mercor for the violence, the intense burning, and the rapid spread. The throat is enormously swollen, the glands are swollen, and the thirst is insatiable. In dysentery there is more violence, copious bleeding, great anxiety, can scarcely leave the stool a second, great tenesmus of rectum and bladder, urging to urination and stool is constant, great burning in the rectum. It is a violent case of dysentery. I would prefer Merc in ordinary Merc cases, but if this patient is not relieved he will not live, and Mercor is needed here. In the urinary organs the symptoms are violent. Albuminuria is more marked in Mercor than in Merc. It is one of the most frequently indicated remedies in the albuminuria of pregnancy and a very useful remedy when gout is present. From slight irritation of the foreskin of the male organ, the mucous membrane and skin contract and phimosis takes place. Mercor relieves the itching and burning, and causes the purse string to let up. It is seldom indicated in gonorrhea, but is called for when there is greenish yellow or bloody watery discharge, with violent burning and urging to urination and to stool, and violent painful erections. Chancres spread with great rapidity. Stitching, rending, tearing pains, here and there, especially in the chest. Thanks for watching this video. If you want more videos like Mercurius corrosivus, please subscribe to this channel and press the bell icon. To learn homeopathy course online free with Homeopathy Materia Medica. Comment us your feedback and what you want in the next video. Like and share this video with your friends and family. For paid and free consultancy online, visit homeopathymedicines.com and mashclinic.com. Thank you. Have a nice day. Stay healthy, stay happy.